So let's go on and kind of start the topic here. So we so I guess from a definition standpoint, what is tinnitus, Lacey?
So tinnitus, you can pronounce it tinnitus or tinnitus. Uh, Potato, potato,
Mm-hmm.
tomato, tomato.
Tomato, yeah.
So it's the perception of sound when there's no actual external noise present.
And I think oftentimes patient hear this kind of high pitch ring, something like this, like that, right? So that high pitch ring, and it doesn't have to be a high pitch ring.
No.
It could be we oftentimes hear it as a buzzing or hissing or whistling, swishing, clicking. It could be described in all forms, and in some rare cases, even like they feel like there's music or speech, and then some other ones are like a kind of rhythmic
Whooshing
or like a rhythm type of heartbeat.
Yeah.
So like a pulsating tinnitus. And so we want to talk about the different types, and we want to talk about what different forms are there, and we'll go into that in more detail. But how common is this problem?
So 15 million people experience tinnitus. According to Stats Canada, 15 million or 42% of Canadians have actually experienced tinnitus at some point in their life.
And interestingly, out of the 15 million, one in five, about 3 million people report that they have a severe enough tinnitus to affect their concentration, sleep, or mood. So it is a big problem. Okay.
Yeah. Now there are different types of tinnitus.
Yeah. So for example, the two main types that we talk about is objective and subjective. Okay. So let's talk about objective, because objective happens on a much more rare cases, and objective tinnitus is basically a tinnitus that is actually audible to not only the person but potentially other people. So oftentimes the tinnitus is very soft, and it is not audible by other people. They're not hearing the same sound that you're hearing.
Yeah.
But these sounds are created by what we believe is what we call somatic sounds. So sounds that are generated from potentially our internal body system. So even circular blood flow issues could cause that pulsating tinnitus. So I really want to kind of take this moment here to kind of get everybody to practice this, because if you ever hear anybody who has pulsatile tinnitus, you should kind of just get them to double check, so you can get them to just kind of feel their pulse, on the neck right here, and hopefully not like me that I feel like I'm kind of dead, but because I can't feel my pulse. But if you kind of think about the tinnitus, or if they can hear the tinnitus and it matches the rhythm of their heart, that could very well be a circulatory issue. And we don't take that very lightly. Our advice to patients when they tell us that they have pulsatile tinnitus is that absolutely please see your general practitioner about this problem, because it could be a circulatory issue. So it's a turbulent blood flow, right? So if you think deeply about what turbulent blood flow could potentially be caused by, could be some cloggage of the blood or arteries, and that could lead to potentially much bigger issues, right? So please don't take that lightly, okay? So that's the first thing. So again, objective tinnitus really accounts for about 1% of all tinnitus cases. So 99% of the time, it's not that, and it's the other type. And what would the other type be?
So subjective tinnitus, which is a sound that you are only able to perceive. So if you were to ask someone else if they can hear it, they would not be able to hear that sound that you're hearing in the head. And this is usually traceable to auditory and neurological reactions to hearing loss, but it can be caused by other issues as well.
Yeah. And so I think what people really need to understand is that tinnitus is kind of what we look at as a stress related symptom. So it's not directly affected by all stress, but stress can definitely heighten or make your condition of tinnitus worse. So oftentimes, people often tell us that at the end of the day, they feel that tinnitus more, or first thing in the morning, or when it's really quiet at night when they go to sleep. That's probably the most common. and we hear less cases where they go to a bar or they go to a restaurant and when it's busy and then they hear the tinnitus more. So
Right.
usually it's the other way around, right? So and oftentimes when they're under emotional or psychological stress, the tinnitus seems to heighten as well, and also physical stress.
So it doesn't necessarily have to be mental stress, right?
Exactly. So I think in general terms, all stress kind of causes the tinnitus, and this is very similar to, how I would oftentimes describe the patient as like like a headache, kind of thing. So the thing is, it's exacerbated by stress, right? Okay. So we'll talk about that headache example in a sec, but so what are some common causes of tinnitus? Like how do people get tinnitus?
Yeah, there's quite a long list, right? Many different causes, something like chronic pain, acute pain, TMJ, so problems with the jaw.
I have that.
Do you?
Like if I go like this, if I like open my jaw really big, and I hear that click, I can hear it really good. So yeah, oftentimes people who have TMJ complain that they hear the tinnitus. So when they get the TMJ treated, sometimes the tinnitus just goes away. So it could be a direct cause, right? So that's what we're talking about, right? So any stress in your body that can cause that. So whether, as Lacey just said, like chronic pain. So if I have a back pain or neck pain and it's chronic, I'm stressed about it all the time, right? Or my body's stressed about it all the time, and that stress adds to this problem. Okay, so just keep that in mind. So what are some of the other types of stress?
Yeah, so certain ototoxic medications, for
What's
example.
that?
So it's a technically, if you break down the word ototoxic, toxic to especially our auditory system, and that can result in problems with damage to the hair cells. Something like a benzodiazepine, that's say like a sleeping pill or Xanax or antidepressant, that's been known to affect our hearing ability and our tinnitus as well.
And also a lot of the cancer treatment type of drugs that you're prescribed to, they oftentimes people instantly get tinnitus as well. I remember that as well. Like if you take enough aspirin, you also get tinnitus.
Yeah.
So
you have to take it in high doses, but still, it is
possible.
So
so anything that causes a stress in your body, right? Okay. What else? What other things?
Lack of sleep, fatigue, depression, anxiety. Yeah.
So those are all good causes. So I think before we talk about treatment, we really got to understand causes. Okay.
Yeah.
And so I think, but the key thing I think is that out of all the causes that can kind of exacerbate or add to your tinnitus, 90% of the time, 90% is a big figure, but 90% of the time, the tinnitus is caused by a hearing loss. So that is why I think typically when you go to your GP and you say you have tinnitus, other than potentially they say, well, it's been a chronic condition, so it's like all other conditions, try to live with that or try to just cohabitate with that or no, cohabitate with that, right?
Yeah.
So just try to live with it. But oftentimes, and we get a lot of patients coming into us saying, hey, I have tinnitus and I'm sent by my GP to have a hearing test. And at that moment, they probably, a lot of times, they still don't know why they need the hearing test. So let's talk about the relationship between hearing loss and why is there such a high correlation, right? Okay.
Yeah.
So to do that, we're going to talk about the parts of the year. So I just want to make sure that people understand, kind of how the years work and why we think that,
yeah, and you can refer to, we'll have this model here to show you, but you can also refer to the slide here, the diagram.
Yeah, and as we go through this diagram of the year here, we first of all have sound that comes in from the outside and it goes in through the outer ear, and then it vibrates this eardrum right here. Okay, so this is our eardrum right here, and then from there the eardrum vibrates these three bones that's in the middle ear, that's behind the eardrum, and these bones help to amplify sound about 23 times, and after that the vibration energy gets transferred into the cochlea, which is the snail-looking structure shell right here, and the cochlea is what we often talk about as the inner part of the ear. And inside the cochlea exists three sets of hair cells. So there's three outer hair cells and one inner hair cells. And these hair cells combine to help capture the vibration or instantaneous energy. And that is how, and it gets sent to the brain via the auditory nerve. So very similarly, if you think about the eye, for example,
Right.
like we don't really see an image. We see an image, we capture an image like a lens on a camera in our eyes, and from there we define in our retina the location of the colors, intensity, and the characteristic of the color and light, and that all that information is sent to the brain, and our brain reconstructs the image that we see in front of us, like the way you're seeing us, and that works on an instantaneous level, and that's pretty miraculous how we actually able to do that. And in our ears, same thing. We pick up different frequencies, different sounds, and we're able to process that and instantaneously capture that. So the question is, what if we have damage in the hair cells caused by what potentially?
Loud noise exposure. So say if someone's working in lots of construction, if you're a musician, you're around lots of loud instruments throughout the day. If you have a hereditary hearing loss as well. Yeah,
so it does get passed on potentially. So we oftentimes ask family history, right? So if your father had it and your mother had it, and like the chance of you having a hearing loss or having similar conditions at that age group correlates very well.
Exactly.
Right?
Or physical trauma too, right?
Yeah, that's why in our business we oftentimes have generations of patients.
Yeah.
So that we would see. I mean, I haven't been doing that long, but there's sometimes I do see the transition where the father or the mother has come to us, and then now the children has come to us as well, right? Yeah. And then of course, aging is the big one, right? So as we age, we deteriorate. I once read that by the age of 30, after the age of 30, we lose approximately 0.5% of our hearing a year. So if you kind of think about from a mathematical perspective, by age 60, approximately on average, we lose about 15%.
Yeah.
And by age, you add another 10 years, you lose another 5%. So 0.5% a year. So that's kind of the general guideline. So oftentimes people say, "Hey, I'm only 75. I mean, should I have hearing loss?"
Right.
Absolutely.
Of course.
Yeah. I mean, should your eyesight be the same as when you were 18?
Right.
No.
No.
I mean, same thing. Should your hair turn a little bit whiter? Absolutely. Yeah. And those are all signs of aging, and I think the key nowadays is talking about healthy aging, right? And how do we prevent things?
Exactly.
So yeah. So I guess what we want to show here, what you see in front of you is a slide of what we saw as the healthy hair cells and unhealthy hair cells. So when you see the hair cells getting limp like that, that is the unhealthy hair cells, right? Okay. So what happens when we have deficiency in our ears? So the key thing is when we have deficiency in our ears, we have a lack of hearing. And that lack of hearing could be a permanent thing with the hair loss that we just talked about. Or it could sometimes be very instantaneous. So we have patients coming in sometimes and they say, "Hey, I suddenly developed this tinnitus in my 1 year."
Right.
And oftentimes we look in the ear, for example, and we see that there's a complete wax blockage, right? So we do practice thermal management in our practice. So when we remove the wax safely for the patient, the tinnitus goes away. So we know that there's a high correlation. And so if you think about it, even though you may not have earwax, if you have a permanent hearing loss, it causes the same effect, right? And that triggers the tinnitus. Yep. So what I think we want to really kind of drill down into now is how exactly does that actually work? Is I want to draw to an example that maybe you can tell us a little bit about, Lacey. The example I'm thinking about is the Helen and Bergman example in 1953.
Okay.
Yeah. So can you maybe share that with us? I think that really kind of summarizes how the direction of tinnitus and our thinking is about why we have tinnitus.
Yeah.
Yeah.
So if anyone has heard or haven't heard about an anechoic chamber, and David's been at one, actually myself as well, we got the opportunity to do that at 2 different times.
Yes.
But basically this chamber is more soundproof than your average sound booth that you go into when you have a hearing test. So these sound booths are at 0 decibels. and you walk in and there's a mesh floor, and surrounding you is giant pieces of foam. They look like spiky foam.
Mhm.
And so right away when you walk in there, you can tell it just almost feels like dead sound is what like I would describe it, right?
I feel like I'm in space.
Exactly.
Like, if without the whole spacesuit,
Yeah.
but I feel like, oh, this is how space would be like, because there's
Yeah.
no sound, there's no air. I feel like if I'm in there longer, I would breathe all the oxygen and die, kind of thing. Yeah.
Exactly. So so there's an experiment done where 80 people with normal hearing between ages 18 and 60, they thought they were being interviewed, and they were asked to sit in this anechoic chamber and wait for a few minutes. And after 5 minutes, there's an interviewer that came in and asked them, "What do you hear in this room?" And the response was that 94% of those people actually explained symptoms that sounded exactly like those that are correlated to tinnitus.
Yeah, so they complain of a high-pitched ring, right?
Exactly.
Okay.
Yeah, when they never realized that they had anything before going into this chamber.
Yeah. And this is a profound discovery, because historically we always thought that you must have a condition, or you must have some sort of underlying cause before you can have tinnitus. How can it spontaneously happen, right, to people who have never had tinnitus? And what this really told us was that our body, and it starts to draw the attention that our ears and our mind is always assuming there's some sound. So even in a quiet room like this where we are in the studio, it's relatively quiet and you can hear our voices very well. But there's an ambient level of noise. And there always is, and there's always an ambient level of noise in your home, and even when you're sleeping, you can hear some sounds, right? But when we put ourselves in a situation where there's no sound, our body, I guess what the experiment is trying to prove is that the system, the auditory system, extends itself or reaches a heightened sense of sensitivity, and it starts to look for that any sound, because it's not used to hearing nothing. And that extension or that hypersensitivity is what we think happens with tinnitus, and that causes the tinnitus. So we can use an experiment to prove it or induce it, but at the same time, if we have an underlying condition like hearing loss that actually causes this lower sense of hearing, our body naturally compensates as well. And that actually is the number one reason for developing hearing loss, or developing tinnitus. So that's the kind of the correlation between the two, right? Okay.